Okay, let's dive right into this explainer. Today, we're looking at something that has fundamentally shifted the entire landscape of medical care, and that is the evolution of minimally invasive spine surgery. Look, if you or someone you love has ever faced the prospect of spine surgery, you know exactly how daunting it can feel, but the field has advanced so dramatically. We're going to explore how these minimally invasive techniques are completely reshaping modern spine care, and honestly, more importantly, what recovery actually looks like today compared to just a generation ago.
Here's a quick look at our agenda. Section 1. The evolution of surgery. 2. What is minimally invasive? 3. A meaningfully smoother recovery. 4. The Vertrae Surgery Center. 5. When open surgery fits. And 6. Starting your spine journey. We've got a lot of ground to cover, so let's get into it.
I want to start by really anchoring us to the emotional and practical reality of modern spine care. Walking out the same day, sleeping in your own bed that night. For a long time, spine surgery meant days stuck in a hospital bed and a massive, painful interruption to your life. Now, it's about returning to ordinary life faster, getting back to the things and the people that actually matter. That's the true promise we're talking about here.
So the crucial point to understand is that spine surgery is no longer defined by months of agonizing recovery and total life disruption. The entire philosophy has shifted. The goal today isn't just to fix the mechanical problem, but to prioritize less collateral damage to the perfectly healthy tissues surrounding your spine.
Section 1. The evolution of surgery, changing the path, keeping the goal.
To really grasp how far we've come, we need to look at the timeline. In the past, achieving a surgical goal meant large incisions, literally cutting through layers of muscle, and spending days recovering in a hospital ward. Fast forward to our present reality, and we're looking at smaller pathways, parting muscle rather than cutting it, and incredible outpatient options. And looking to the future, we're seeing continuous miniaturization and truly awe-inspiring sub-millimeter precision. The absolute brilliance here is that surgeons are safely achieving the exact same surgical goal, but they're disrupting far less healthy tissue to do it.
Which brings us to Section 2. What is minimally invasive? Defining the modern standard.
You hear the term MIS thrown around a lot, but what does it actually mean when you're in the operating room? Well, minimally invasive spine surgery is a targeted approach to access the spine with significantly less disruption to the surrounding muscle. But listen, here's what you really need to take away from this. Minimally invasive does not mean minor. It is still a highly targeted, muscle-sparing way to do a real serious operation. You're achieving the exact same goal, like decompressing a pinched nerve or stabilizing a spine level, just through a much smarter pathway.
So how does that actually work step by step? Step 1. The surgeon makes a small incision, often just about an inch long. Step 2. Instead of cutting the muscle, they use special instruments called tubular retractors. Think of it like gently parting the muscle aside to create a narrow working channel. Step 3. They utilize advanced camera-based visualization and robotic guidance to stay perfectly oriented. And Step 4. They accomplish the surgical goal while leaving your surrounding anatomy largely intact. It really is a masterclass in navigating to the spine without causing unnecessary trauma.
And when you compare these two approaches side by side, it becomes incredibly clear why MIS leaves you with significantly less to heal from. Historically, open surgery required long incisions and significant muscle cutting, simply because, well, that's what the older tools required. You literally left the operating room with a much larger wound to heal than your actual spine problem required. MIS flips that entire script. Targeted access and muscle-sparing retractors mean you wake up with more of your normal anatomy perfectly intact.
Section 3. A meaningfully smoother recovery. The evidence.
Now, it's one thing to talk about concepts, but let's look at the hard data. This is from a 2015 meta-analysis published in the European Spine Journal looking at lumbar fusions. The average blood loss from minimally invasive surgery drops to just 177 milliliters. Compare that to a massive 461 milliliters for open surgery. That is a huge, measurable reduction in surgical trauma, and less blood loss naturally translates to a significantly safer operation for the patient.
And the evidence just keeps piling up. A more recent 2022 systematic review, also in the European Spine Journal, looked at 53 different studies comparing MIS with open surgery for degenerative lumbar conditions. The results? Shorter hospital stays, lower blood loss, lower complication rates, lower surgical costs, and earlier mobility. Let's be clear, these aren't just flashy marketing claims. The clinical data completely backs up that MIS provides a meaningfully smoother early recovery.
So what does earlier mobility actually mean for your day-to-day schedule? Well, according to study medians, patients undergoing a minimally invasive decompression often return to driving in about 2 weeks. 2 weeks! For a fusion, it's around 3 weeks. These timelines are a game changer. They highlight a rapid return to ordinary life, literally replacing months of painful waiting with just weeks of recovery.
Moving on to Section 4, the Vertrae Surgery Center, built around MIS. Let's look at how this advanced approach works in actual practice at a highly specialized center. The crucial point here is that Vertrae makes MIS their absolute default approach whenever the anatomy allows for it. It's not just a secondary option, it's the very foundation of their practice. Dr. Kamal Woods is a dual fellowship-trained neurosurgeon with advanced training from Cedars-Sinai. He leads this spine-only outpatient center equipped with the Mazor X robotic guidance platform and advanced camera-based visualization. By combining that level of world-class training with technology that allows for sub-millimeter precision, they make those tiny 1-inch incisions incredibly effective.
For most everyday spine problems that bring a patient into a consultation, things like a pinched nerve needing decompression or a single-level fusion, the question isn't whether MIS is an option. The question is simply which specific MIS procedure will accomplish the goal. Because of the highly targeted nature of the Vertrae Surgery Center, these common conditions are perfectly suited for their minimally invasive outpatient model.
Section 5. When open surgery fits, the right operation for the right case.
Now, we have to be clinically honest here. Good spine surgery isn't about stubbornly forcing every single case through a tiny incision. There is a specific set of situations where an open or hybrid approach is absolutely the right answer. We're talking about complex spinal deformities like severe scoliosis, extensive multi-level problems, or revision surgeries where thick scar tissue has totally altered your anatomy. In these highly complex situations, choosing open surgery is not a step backward. It's the absolutely correct clinical decision to give the surgeon the exposure they need to ensure your safety and your success.
It's really fascinating to note what the research says about long-term results too. For many common degenerative conditions, the long-term functional outcomes between MIS and open surgery are actually quite similar, assuming the correct surgical goal is met. The ultimate destination is the same. The major difference? The path you take to get there. MIS ensures that your early recovery journey, the part you actually have to wake up and live through day by day, is vastly less painful and much less disruptive.
Section 6. Starting your spine journey. Looking at the whole picture.
So how do you determine if this optimistic, minimally invasive path is right for you? Well, if you're considering surgery, the decision cannot be made just by glancing at a scan. Dr. Woods and the Vertrae team don't just look at an MRI and make a ruling. They evaluate your physical exam, your history, and crucially, your personal goals. They involve you in a comprehensive conversation about what you actually need to recover to. Do you want to walk your dog again? Pick up your grandchild? Get back to a physically demanding job? That context absolutely matters.
I think this quote perfectly captures the whole philosophy of modern spine care at Vertrae. The technique is the means, the patient's life is the goal. All of this incredible technology, the Mazor X robotic guidance, the tiny tubular retractors, they honestly only matter because they give you your life back with as little interruption as possible. Which brings us to our final thought for this explainer. Are you ready to see what recovery can look like for you? If you're dealing with a spine issue and want to know if a minimally invasive approach is your best path forward, the next step is entirely yours to take. Gather your imaging, bring your questions, and consider reaching out to a specialized team. You can request a consultation with Dr. Kamal Woods and the Vertrae team right at vertrae.com. Modern spine surgery has evolved dramatically. The days of accepting months of lost time as the mandatory cost of fixing your back are over. The only question left is, are you ready to reclaim yours?